Okay, in terms of talking about crowns and bridges, now we're talking about permanent bridges, and I'll explain what that is, because it sounds like it's a bridge over a highway, but it's not. But when would you need a crown? Say your tooth breaks in half. Say you have a really big filling in your tooth and the rest of the tooth, and this is pretty common. You get these big fillings, especially when you've been younger, when you were younger. You've become an adult, now you have these teeth with these large fillings. The teeth have been severely weakened when you put these big fillings inside your teeth. Teeth were not made to have fillings. Eventually these teeth will break. So yeah, a lot of times when if a 6-year-old or a 10-year-old, you're not going to put a permanent crown on these teeth, on their permanent teeth. But when they get older, yeah, then you do. Because if you try to do it too young, a lot of changes occur in the mouth, and you'd have to redo it as they get a little bit older. So when they reach the right stage, they can be in their 20s, 30s, whatever it happens to be. Why wait for the tooth to break, and they might lose the tooth or have a toothache or an emergency, or the cost gets, you have to take the nerve out, and they're spending 2 or 3 times as much. The best thing is to put the crown on the tooth first. That way, they'll have the tooth, they're going to avoid emergencies, they're going to avoid pain, they're going to avoid additional costs. And when they get older, they'll thank you. Because these older people that are missing a lot of teeth, when you get to a certain point of certain teeth missing, they're not very happy. And I read another study, and I've seen this many times too. People that lose all their teeth reduces their lifespan by 10 years. They lose 6 to 8 teeth, reduces their lifespan, I think, 4 or 5 years. In addition, depending on where you lose them, this could be a cosmetic nightmare. And it's difficult chewing with a lot of missing teeth. And it puts other strain on other teeth. And then people that, you can keep expanding this. People that have trouble with their jaws or get a lot of headaches, well, this will lead to that too. It's another factor in that. Now, in terms of, you mentioned bridges. So bridges are a way to, say you're missing one tooth. So, you want to replace that tooth. And obviously implants are one way, but sometimes for one reason or another you can't put an implant there. So you can replace it with a permanent bridge. And it's similar to, we were talking about putting what people call a cap or a crown. You put one on each tooth on each side, and then you attach the one that's missing in the middle, and that's called a bridge. Then you put that whole thing on, then that's a permanent replacement, which is excellent. It looks good, it's permanent, it stays there, you don't have to take it out. When you're eating something sticky or something, it's not popping out of your mouth. And you can chew a lot better. And as it gets towards the front of your mouth, obviously it's going to have a greater cosmetic effect too.